Hello and welcome, everyone, to today's Make It Safe Expert Series Lunch and Learn on the upcoming regulatory changes for occupational first aid. My name is Anna Rowinska, and I am your host today, and thank you for joining us. To adjust your audio settings, click the microphone at the bottom left of your screen, then click the up arrow to select various audio controls. Although your microphone is muted, you can ask questions at any time using the Q&A icon at the bottom of the screen. Please use the comment section to chat with attendees, share your thoughts, and let us know where you're from. Heidi will respond to as many questions as she can during today's session, and anything that she's not able to answer, we'll get back to you in our follow-up email. Our moderator today is Doris Toman, Services Experience Manager at the Manufacturing Safety Alliance of BC. Welcome, Doris.
Thanks, Anna, and welcome, everyone. We are joining you today from the Fraser Valley office of the Manufacturing Safety Alliance of BC, located in Chilliwack on the traditional and unceded territories of the Stalo Coast Salish people. We are grateful for the opportunity to speak with you from these lands today. The Manufacturing Safety Alliance is not-for-profit health and safety association for manufacturers and food processors in BC. Our team of health and safety experts are here to answer your questions and to assist you towards core certification, the Occupational Safety Standard of Excellence for Manufacturing. We are here to support the continuous improvement of your continuous improvement of your health and safety programs to prevent injuries and promote workplace wellness. Call on us anytime for health and safety training, information, tools, or advice. A quick note before we start this morning, and before I introduce our presenter today, in case you missed her message yesterday, Provincial Health Officer Dr. Bonnie Henry shared that while COVID-19 activity has continued to decrease since early October, influenza A and RSV are on the rise. As you and your employees are heading into the holiday season, now is the ideal time to schedule your vaccination to prevent the typical late December, early January peak of respiratory illnesses. According to the BC Centre for Disease Control, it is primarily the H1N1 strain of influenza that is circulating, which is less likely to cause severe illness in older people, but can cause more severe illness in younger people. If you haven't already, this would be a good time to encourage your team to book their flu vaccines. In today's Lunch and Learn on First Aid, we will be covering the key changes that have been made to the OHS regulation relating to first aid. This is the first update in nearly 20 years to this part of the OHS regulation. Today will be an introductory information session to review what has been shared to date, including what the changes are and the new responsibilities for employers and workers. A more detailed webinar on this topic will be done with WorkSafe, and that is planned for early 2024. To lead us through these changes today, we have Heidi Hare, CRSP and Senior Safety Advisor at the Manufacturing Safety Alliance of BC. Welcome, Heidi.
Thank you, Doris, and welcome everybody. I appreciate everybody's time today and thank you all for coming, and hopefully we can work through this and give some information to help everybody understand what's upcoming and what's going to be required of them going forward. And we are always here to help you with any of this. You just have to reach out and we're more than happy to be able to provide some support. So we will be talking about the regulatory changes, talking about what's now and what is coming up, and then giving you a little bit of a basic timeline of when we have to get this done. So I want to reiterate that today's session is information only. We've taken the content from the WorkSafe BC communications on this topic to date, and we've tried to make it into a digestible format to help you understand it and go through what it is that you have to change and where you're needing to make significant changes and what's going to stay the same. As Jury said, there is going to be a webinar upcoming in the spring of 2024 from WorkSafe that's going to be going through more of the guidelines on this and providing a little bit more detail on things once they have the information coming up, especially when it comes down to our training and the first aid requirements. So the requirement to provide first aid services is a responsibility of all employers in the workplace. The level of first aid is going to depend on a variety of things. The requirements are listed in Schedule 3A of the regulation. And as Jury says, they've been in place for almost 20 years with minimal updates. We have had some improvements during this period with both the first aid training and equipment, as well as the issuance of the Canadian Standards Association standards for us to follow. So these are guidelines for us to line up what we're doing and how we're doing it, and some of the information are there. So we have had some changes within the last 20 years, but we've got some significant changes coming forward. So a little bit of background on this. The past spring, WorkSafe BC approved the amendments to the first aid regulation. So this is a big thing. It goes through public consultation and it gets passed through, and they've finally gone through and said, we're going to go through with this, and they've made the changes. There is a section from WorkSafe BC that did highlight the recommended changes to it. And what we're going to do here is we're going to talk about some of those highlighted recommendation changes. Some of it is addition, some of it is subtraction, some of it is complete changes to the actual Schedule 3A. So the goal of this amendment, of these amendments, is to make sure that we reduce the confusion around first aid and how we're going to get it done and what we actually need to do depending on our workforce and our workplace and where we are and access and all of those things. The other big change is that we've got the alignment with the CSA standards. So we've got both the training and the equipment kits that were laid out in these CSA standards. And that's really important because now we go through and we say, these are exactly what we need, and there's no confusion going forward. We have until November 2024 to be in compliance. So this is not something that we have to have in place by January 1st, but we've got some time, and we're going to work through the timeline for us to be able to do that. And all employers in BC are affected by this change. It can be minimal or it can create a big impact. But again, we're here to help you and support you and make sure that you have exactly what you need, and to provide the guidelines for you to be able to make the changes without minimal disruption. So what has changed? We have the basic requirements under Section 3.16 right now, and they've been replaced by a two-part duty where employers must establish the workplace first aid requirement. So we have this requirement now, but we've changed the definition here and the requirements in it. And we talk about the supplies, facilities, and first aid attendants that are required in the Schedule 3A. The big change as well is the written risk assessment for each workplace. While we certainly do a risk assessment right now, we have it written and it's clearly defined what is supposed to be assessed, who is supposed to be a part of that assessment. So if you have a joint committee, then the joint committee should be part of that assessment now. You're going to address the workplace, the workers, and have a really clear understanding of who's going to be involved and how you determine this, okay? So I read this through, and again, I get a clearer understanding. They're really defining things. And to me, that's a big deal because I don't want to leave things to interpretation. I don't want to say, well, what if I'm this and what if I'm that? We want to remove the what if safety and go forward and make sure that it's exactly what we need. There's also a very clear alignment with these CSA standards, and we're going to provide some information to you going forward. We'll have a handout and a summary from all of this that's going to provide you information on how to get access to those CSA standards. Because they're cited by WorkSafe BC, they are provided to you for free. You don't have to pay for it. You just register, and then you will get access to the CSA standards, and that's going to help us going forward to provide all of the information that we need. So Schedule 3A, the big one here, we all refer to it, we all go to it, and it's in table format. So now what we have is a layout of divisions and sections. So Division 1 is the interpretive information. That's really important because it says you shall. And then we go into sections on definitions. Again, very important because we want to be able to define things. What is an ambulance? What is a less accessible workplace? What does this mean? Our Division 2 are the minimum requirements, and this division is separated into sections 2 to 6, and that is all the training requirements, the first aid kits, the dressing room, or the actual first aid room requirements. So it's very detailed. And again, everything is aligned with those CSA standards. Okay. So currently we have the Schedule 3A. We look at the different first aid level, and they are based on how long it takes to transport an injured person to a hospital and the number of workers per shift. Our hazard rating for this is also changing. We're going to an industry hazard rating as opposed to the risk of injury. So we have a low risk of injury. We have a moderate risk of injury. Well, what does that mean and how do we define that? We do take into account our industry rating when we look at our first aid assessments, but now is very clear what these definitions are and how we apply our industry rating to our assessments. We also like the fact that, like I said, they're going in with these definitions and they're not going to say that we are less than 20 minutes or more than 20 minutes away and we're high risk of injury. We clearly define things based on remote, less accessible, and then our industry rating. So we've got some very good definitions here and some very good guidelines of what it is that we're supposed to be doing and how we put this into place. So we'll talk a little bit about our definitions. I'm not going to go into all of the changes of the definitions because it's all out there, but the things that I feel impact us the most. Ambulance, so we have a definition of that. And again, some of these sections are very simple changes to them, which I like simple changes, and they're easy to interpret. We've got some changes here so that we get clarity and we have consistency. So in our regulation, we say workplace, but in the Schedule 3, we say work site. That is just an example. Please don't quote me on that, but I'm saying here that we've changed it all to be workplace so that, again, there's clarity and consistency for things. Our hazard rating now is expressed in low, moderate, or high, okay? And it applies to our workplace and not the risk of injury that we've got, okay? And then our remote workplace is where an ambulance cannot drive within 30 minutes from its base under normal travel conditions. So what are our barriers? Currently, we have the barriers are, is there a gate? Is there railway crossing? Is there something in the way? What are our barriers to that? So we've come in and we've given a little bit more information on our remote workplace, and it says where we can't drive within 30 minutes. So I'm going to a Forest Service road and I can't get up there. I am on a small road, I have to cross the water, et cetera, et cetera. So we've got some definitions behind that. So the big one here we have is our less accessible workplace. I'm going to talk about this and I'm going to give some examples of our less accessible workplaces. So we can't reach these workplaces by traveling by land in an ambulance. Okay. They also have work areas where BC Emergency Health Services attendants cannot safely access. So this is part of the definition of the less accessible workplaces. So what do we have and what are some examples of these less accessible workplaces? So things that are accessible by only ladder, scaffold, temporary work platforms, rough or complex terrain that's going to require an injured worker to be carried out for a significant distance. Okay, the only means of access to this area involves steep or slippery slopes or embankments without walkways or trails. And finally, on this one, we have our radio controlled area. So we have no cell service and we're only going through there with radio controlled. So this is going to change part of our assessment. And we've got some air transportation requirements as well, where we must have things in place before we go into work. We do that now, but there's a greater requirement for it and there's a bigger definition around air transportation. Some other examples of less accessible are confined spaces, areas within limits of approach of high voltage electrical equipment. So we're working in and around that. Oxygen deficient or toxic atmospheres may exist. So again, likely associated with our confined space. Workplaces at high angles or where fall hazards could exist. So those steep slopes, those embankments, that sort of things. We have risk of entrapment. So again, if any of you know, these are all certainly confined space definitions and criteria that are associated with the confined space. So not to harbor on the confined space, but is definitely a less accessible workplace within a workplace. So section 2 or division 2, this comes into our minimum requirements, okay? So the training is set to be aligned to the CSA standards for June 2024. That's what WorkSafe is putting out there. So right now we have training requirements. You're all used to your level 1, level 2, level 3. So the current program, it's called OFA 1 and it's 1 day in duration, okay? Then we have our 5 days and our 10 days. So you can see the biggest change here is that our level 2 is called an intermediate first aid and it's a 2-day requirement for training. Our advanced first aid is the old OFA 3 and it is 10 days, okay? So again, the date for alignment with this from WorkSafe is June 2024. They will have everything out and you will check to make sure that you've got the right training in place and there's enough time to have your people trained, okay? So that's part of our guidelines of our timelines of what we need to do and when we need to do it. If there's a change to that alignment, WorkSafe will be sure to tell us, and there's going to be probably a grace period. Again, don't quote me on that, but if we think back to COVID times and when we were having to renew our first aid certification, there was no availability of it because of the COVID restrictions and the possibility of the contracting COVID, et cetera. They gave a grace period for first aid attendees to be recertified. So again, don't quote me, but we could have something going forward where there might be a little bit of a grace period depending on the timeline of them having the training aligned and the service providers aligned with the CSA standards. I don't know what is the complexity of changing it to that, but to me, to go from a 2-day training, from a 5-day training to a 2-day training, you're going to have a little bit of a change there. So hopefully we'll be able to get some more information on that as well in the spring from WorkSafe. So we will talk about our certification in section 2, then the general requirements for the first aid kits, the dressing stations, the overnight care and emergency transport. So I'm going to touch briefly on those as well. So again, take home message here is June 2024 for the alignment for the training, and stay tuned. So the other one that I feel is very impactful, that's a big change, is section 3.17 to the, it's an addition to the first aid procedures. This is brand new. So what we have is 3.17 subsection 4, at least once a year and whenever the procedures change, the employer must ensure that drills are conducted to ensure the procedures are effective, workers, first aid attendants, and other persons are capable of fulfilling their roles and responsibilities. So what does that mean for you and how do we do this? A lot of the things that we have coming up, so we've known that these regulation changes are changing and we've known of them for a little while. One of the things that I've been recommending to a lot of my clients, I do a lot of confined space mock rescue. I am suggesting that while we do our confined space mock rescues, we do a first aid drill at the same time because we're dealing with first aid, we're dealing with communication when we do those. So we want to have a drill. So now we have a requirement to do first aid drills so that we're just going, well, where's my kit? Where's our stretcher? Where's this? How do we get there? So the timing of it, just like when we do a fire drill, we want to make sure we see it takes 3 minutes to get out of the building. This is how we did it. Then we do a debrief on it and figure out where we can make changes to it, if there's something that we can make better, if there were barriers to getting there. So they want you to practice doing first aid drills, which is very important because if I get trained as a level 1 first aid, which I have been, when is the last time I've used it? I couldn't tell you the last time I used it, probably in my training, because thankfully I've never had to administer first aid to anybody on site. So it's really important to refresh our skills. We do it in all sorts of other areas within our workplace. And we make sure that we have refresher training and skills demonstration so that we know what it is that we're doing. So when the time comes for that emergency, we're prepared and we know exactly what we have to do. And then we can also learn from the experience to make that sure that things are better going forward. So this is a big one, and it's probably an easy one to take into account. Not so hard to get it done, but we just have to remember to do it, and that it is now going to be a requirement. So our first aid kits. So again, it's aligning with the CSA standards. And again, these are available to you. This is in the new section 3 and under the general minimum requirements. It should be available in spring 2024. The CSA standard right now is a 2021 version. I do not believe they are updating the CSA standard to change anything. We are updating the regulation to match the CSA standard. So there shouldn't be a new CSA standard coming out. That's not changing. The alignment is from us to them. Okay. So we have our personal kits. You can see we've changed from level 1, level 2, level 3. And we've come into a basic and intermediate and then some requirements in there. So again, the CSA standard is going to outline exactly what we need and make sure that we've got it in place. I feel that there's not going to be a ton of changes. And of course, we do not have to toss out this or bring in that. We just want to make sure that it's all still good. And you don't have to throw it out just because it's not on the list. Okay. So it's probably still good to use unless it's expired. So don't feel you have to toss out a kit and buy a brand new kit. You may just have to supplement it with some other parts. So section 4 and section 5 of division 2, dressing stations and overnight care. So dressing stations and first aid rooms must be located as near as possible to the work areas. They're going to be kept clean and sanitary, and they're going to have a sink. So not a lot of things changed here. Okay. They have to be large enough for an injured worker and first aid attendant and all equipment to fit inside of it. Okay. So just some guidelines on that as well. So we want to make sure that these things are in place, and we look at our current setup for our dressing station and first aid rooms and make sure that we meet the requirements of it. If required, we need to have overnight care facilities. Okay. So that usually comes into place when we don't have the hospital within 2 hours of our workplace. So we'll do the assessment on our workplace and figure out what it is that we need to do. But the first aid and dressing room is probably going to be the bigger assessment and change on this. Section 6, emergency transportation. So this is where we start to take into account our remote and less accessible workplace definitions. So you need to provide emergency services that are capable of transporting the injured worker securely on a stretcher, have effective means of communication between the first aid attendant and the operator of the transportation. So that means the attendant is going to be able to speak with whoever is driving the vehicle. And then you're going to make sure that it's got adequate space for the stretcher, for the injured person, for the treatment of them while they're going and being transported. Okay. You also want to make sure they're protected from the elements. We don't want them getting wet. We don't want dust to get in. We don't want any of that stuff. So when we look at our emergency transport, we're going to take into account a number of things and just do a basic assessment on it and make sure that it's adequate. Again, good, clear guidelines from the CSA standard and the changes to the regulation on this point. So WorkSafe BC updates coming soon to you. So WorkSafe is going to be bringing this forward. They will provide more information session. Right now we have some background information. They've given us the changes to the regulations and we have some guidance on it, but we're going to get clearer guidance on it. Okay. That will help us with conducting the first aid assessments and developing the written procedures behind those first aid assessments, how we're going to count our workers, okay, for the purpose of determining. So what does that look like? Okay. We want to have all of this guidance from WorkSafe BC. And again, clear understanding from them so that we can interpret the regulations appropriately and make sure that we have an effective first aid program in place and a proper risk assessment based on the requirements and that two-part duty. So our timelines on this, what does this look like? So completed by the end of 2023. Well, that's coming up pretty close. I think we're still okay. We're going to go Q1 in 2024. We're going to learn about the amendments. So we're good on that one. Now, when we're done this, I hope that everybody starts to consider how these amendments will impact your workplace and your current first aid requirements. So that's an easy one to say, okay, we're done 1 of 2, 2 of 2. We're going to develop an action plan. So we want to start thinking about what this is going to do and how we're going to do it. And this action plan is going to include completing our first aid assessments, ensuring the certification meets the requirements of the CSA standards. We're going to update any procedures that we have. If we need to get training based on the CSA standards, we'll get that in alignment. And the action plan will include how we're going to train and how we're going to do those first aid drills. So it doesn't necessarily mean by the end of Q1 in 2024, we have to train and we have to do a first aid drill. If we're ready for that, that's awesome. But if not, we're going to make sure that our action plan takes into account when and where we're going to do the training and when and where we're going to be able to do our first aid drills and make sure that it's compliant. Okay, so that's our developing our action plan. So that's not too bad. We're 2 out of 3. Okay, phase 2. So we say Q1, Q2 on this because we're going to have a little bit of an overlap with some of our quarters and some of the implementation. We want to make sure that phase 2 is in place and done by at least September of 2024. I'm going to say that the training requirements are going to be the longest thing and the hardest one to make sure that we're implementing and following through on, just because that's beyond our control and it's going to be a lot of issue with the service providers, etc. Okay. So we want to make sure that we start beginning to implement our action plan. So that created in the beginning of 2024. We want to take into account those supply chain issues. Are we going to be needing something that I'm going to be waiting because it's going to take 2 months for me to get this specific piece of equipment or part of the kit in? Okay, so I've gone from a basic level 1 first aid, and now I actually need a level 2 intermediate with different parts that are required for the kit. So you want to take that into account. Do I have enough people to do the training? Do I have enough people available to be first aid? Start thinking about that, okay? And then we want to make sure that we are changing the rest of our processes within our organization. So when we start talking about our orientations for new and young workers, that the changes to the first aid regulation and all of our procedures and all of that stuff is included in that. So some adjustments to our overall safety management systems. And then we want to make sure that all of this is going and getting done at a nice pace so that we're not rushing at the very end and going, oh my goodness, Heidi, it's September 1st. I don't have anything in place. What do I do? We're going to make sure that we are there for you and giving you gentle warnings and gentle nudges to make sure that everybody's looking at this and see how you're going and doing a little bit of a check-in, and there'll be some more information, and maybe we'll even get another webinar going in Q2 when WorkSafe comes out with the rest of their updates. So phase 3, November 1st, 2024, here we go. So we want to make sure that all of our site-specific training has been done. So our first aid attendants are now trained to meet the standard. We've updated our programs. We've updated our procedures. We have our first aid risk assessments done. We've done a first aid drill, so we know what's going on. We know how we're going to do this. Maybe we have to do 2 first aid drills because we do one in one area and then we have a more complex first aid rescue or first aid response in a different area, depending on what time of year it is. Maybe we're in a slowdown, shutdown, and then we're full on manufacturing and production. So maybe we have to have 2 drills. So we'll look at that sort of a thing and decide when we need it and what would be the most beneficial. I'm going to say if we go in with the busiest time of the year and the most complex first aid response, that's what would be the best one to use. But there can be discussion around that, of course. So that's by November 2024. And again, I'm going to say that the training is going to be the part that's going to have a little bit of the wiggle room here, and going to be the hardest one to make sure that we're all up to date on, just because we're relying on a lot of service providers to be able to change those sorts of things. And then again, WorkSafe will provide us with some guidance on how it is that we're going to be able to go forward and implement this training and update it. So again, you're not alone. We're here to help you. You can contact us. There'll be some information at the end, and you're more than welcome to connect with us. We can help you with anything. There is going to be the handout of a summary of all of these changes and give you the guidelines for your timelines for everything, and then give you the information on how you are going to get those CSA standards. And just remember, we don't have all the answers. This is just a preliminary summary. I wanted to make sure that you are all getting this information and we're giving it to you in a digestible format so that you can process it and put it into place. When I first read the changes to the regulation, I had to wrap my head around a number of different things. And it's really nice to be able to have some very simplified information here for you. And we'll definitely develop more resources, and I'm hoping we'll have some more webinars as things change and information comes out. So that's our contact information. Some of you can contact me directly if you're my clients, and this is the General Safety Alliance contact information, and we get the information and it goes through Doris, and she makes sure that it is sent to the correct advisor and you will get the support that you need. I thank you all very, very much for attending today, and we will move on to the Q&A session of the presentation.
Thanks, Heidi, for sharing this overview. I've already seen quite a few questions from the audience. So again, if you have a question for Heidi, please submit it through the Q&A. We will answer as many as we can today, and any questions that will remain will be covered in a follow-up webinar in 2024. So just one quick thing, Heidi, for anyone who signed in late and might have missed where they will be able to find the regulations, can you reshare that with everyone now?
Sure. So there, if you go to WorkSafe BC, we can put a link in the chat, and we can also get it in the handout. There's a backgrounder information that gives a summary on it. And in that backgrounder, there's a link to the changes and the highlighted yellow changes to the regulation. So we can make sure that that link is provided in the supplemental information coming from this webinar so that you've got copies of the regulatory changes.
Perfect. Thanks. So one of the questions that came in, can you share a bit more detail about how a work site's industry hazard rating and number of workers in the workplace will impact their first aid response plan?
Okay, so this one's going to have a little bit of information coming out from WorkSafe. So what we know right now is we've changed the hazard rating. So right now, the hazard rating is based on the risk of injury. We take into account our industry hazard rating to figure out some parts of our first aid risk assessment. But going forward, that risk of injury is now gone, and it is based completely on your industry rating. So if you're a moderate risk industry rating, you're going to use the moderate risk in your hazard assessment. So before we took it into account slightly, and now we go in more detail, but there'll be some more information on how we apply that, especially to our number of workers in the workplace and the workforce. So that those level of details will come out from WorkSafe.
Right. And for some of the listeners that aren't sure of your industry rating, you can always reach out to us or to WorkSafe to get that information, but it is sent to you and you have access to it when you log into your WorkSafe account. But if you're unsure of where to find it, please just reach out to us. The next question is, will we have to recertify our current OFA attendance, or are they grandfathered in? We have some employees that are recertifying this year.
So I don't believe there's grandfathered in. I believe that they're changing the training requirements to meet the CSA standards, and your current level 1 could meet the requirement of the current or of the new CSA standards. So there might not be a requirement to retrain because you meet those requirements. I'm going to say the biggest change based on what I've seen is that difference between the level 2 and the level 3. Because we go from a 2-day training for level 2 from it used to be 5. So the amount of information and the amount of training coverage is going to change. So that's going to be our biggest effective change going forward. So your level 1s might meet the same requirements as the CSA standard. So we might all be required to have level 3, and the level 2 just might not have the same sort of training and coverage. So that information will come out. If you have a look at the CSA standard for the training requirements, that'll help understand what the levels are as well. So you can get copies of those CSA standards just to have a look.
Okay. One of the questions, and I don't know that we can answer this, but maybe you saw something when you were doing your review. When will we know if there's a grace period? We try to space out our first aid training so that we have 1 or 2 people each month.
I don't know about the grace period. That's a WorkSafe BC answer. And like I said in my presentation, when we talk about COVID and the requirements for retraining in COVID, there were grace periods given to people for not having to have the retraining. So I'm sure they're going to come up with a grace period for this because it will be a significant change for some people. So stay tuned for that one.
Yeah. And again, as Heidi mentioned, the purpose of this webinar was to provide the information in a digestible way so that everyone can start thinking about it, start planning, being aware of it. So we apologize. Obviously, we don't have all the answers because again, we're working and we're providing what we have been provided from WorkSafe. But again, this gives everybody to get in front of it and ensure that they're ready once those timelines come up, like Heidi shared, in the different phases. So the next question again is, will WorkSafe BC come up with a first aid training equivalency list, as in for key training agencies?
I believe they will.
Yeah. So again, we are going to keep these questions that everyone is asking and the ones that we haven't been able to answer and ensure that, we even find that out ourselves so that when we work with all of you, we can have those answers for you. And as Jean mentioned, this will be sent to you along with the handout. So one other question that just came in, is there any information on transportation endorsement?
So I believe that's gone the way of the dodo bird now. Transportation endorsement will not be wording that they will use. It will be covered under a different part and follow the CSA standard for it. So there'll be requirements based on your risk assessment for your training, and that'll come out from the CSA standard. So I believe that will be a non-existent term and training requirement.
Okay. Another one here. Does the drill here means evacuation or first aid?
First aid. So when I gave the example of our confined space mock rescue, part of our mock rescue is going in and retrieving the person from the confined space and calling first aid. So during that mock rescue, we let first aid know that we're doing an entry and that they have to be on call. We call them in, and then they do their drill. They grab the stretcher, they grab the kits, they do what they need to do, they communicate with each other, and they get to where we are to effect the rescue. So we're not evacuating per se, but we're coming in and we're saying, okay, first aid, we're practicing getting our person out of the space. Now you practice getting here because we're dialed in and it takes us 2 minutes to haul them out, but it took you 10 minutes to get here. So you need to practice to make sure you have kits, stretchers, all the things that you need. That's part of the practice drill.
Okay. Good, thank you. In order to properly evaluate the procedures and everyone's abilities, will the expectation be that these drills are not announced beforehand?
No, I'm assuming that they're going to be planned.
Okay.
Yes. I don't think it'll be like the fire drill where you're sitting around and somebody sets a warning bell off and you go. I believe they'll be planned so that you can figure it out.
Okay. And then another question, do we need to have a drill with our staff too, or just the emergency response team?
I believe it's the first aid respondents that need to practice the drill. Okay.
Mhm. And then who will be responsible to set up the first aid drills? Many managers would not know how to set this up.
So I'm going to say that we can come in and toss this over to your joint health and safety committee or your worker safety rep to say, we're going to do a first aid drill. So think about when we do our fire drills, when we do our earthquake drills, somebody's in charge of setting those up. So you should have somebody in charge of your first aid team, and it can just be the joint committee saying, okay, you know what? We have our first aid risk assessment is due in October, and we're going to redo our risk assessment. And then in November, we're going to practice a first aid drill. So you can make that part of your joint committee to make them decide. And then that information goes to whoever the managers are of the first aid people, and then they can set up the drill.
Okay, makes sense. Another attendee, if we have access to our roof, is it required to have a first aid procedure for this separate from our shop? It's accessed only by maintenance and a safety ladder.
So that would be a fall protection plan probably in place. So part of your fall protection plan is your rescue requirements. You're going to make sure you have that in place. And do you have to have first aid readily available at the scene? How are you getting up there? Are you going up a ladder? Are you going through the roof access? So part of your safe work procedure for accessing that roof should include your first aid response. If it's outside the normal realm of your first aid attendants being able to get there. So if you have to go through and have a scissor lift that provide access so that you can cherry pick a person off of a roof onto a stretcher, you have to take that into account and create a procedure for that work area.
Okay, sounds good. Are there any provisions for hybrid remote workplaces when daily attendance on site is less than 1 to 5%? I don't recall if they mentioned.
I don't know whether or not they take into account the hybrid workplace, but with the definition of change from work site to workplace, they might take that into account. And then again, you just have to make sure that you have adequate. So if we have once a month, we have our staff meeting and everybody is there, we need to have adequate first aid for the 30 people that we have at MSABC. But on Monday, we only have our services team. So we have 5-6 people there. So what level of first aid do we have to have? So you're going to take that into account when you do your risk assessments and when you want to provide for the greatest number of people at the workplace.
Right. Okay. Let me see. So this question is about hazard ratings. What if you do different activities in different locations? Is there any leeway on the hazard rating?
So you will assess your hazard rating based on your work site. So if you travel and have your people, so they're installing something at a different work site or they're working at a different location, you will do a site-specific first aid assessment and make sure that you have adequate supplies and adequate people trained to handle the first aid at that site. So if you're going, example, there's a client of mine that works remotely installing modular homes. Sometimes those modular homes are installed way out in the bush because they're camp, right? They're creating a camp. That is very different from their office in West Kelowna. So we do a site-specific first aid risk assessment and we make sure that they have everything they need for working at that work site. And then it's one and done. And you go back to doing whatever. And then the next time, maybe they're only in Penticton and they need something different, okay? So you'll do a site-specific first aid assessment for each of your varied workplaces.
Okay. So another question, we are a staff of 5 in a fabrication shop. We don't have committees. Are these regulations still the same? And if so, how many staff need to be first aid certified?
So right now with your numbers as they are, I would say one person would have to be, depending on your industry rating. I believe the number is 6 and over to have level 1. So you probably need a basic first aid and no level of first aid actual training for now. So going forward, it'll talk about your numbers, it'll talk about your industry rating and see whether or not you need to have that one person trained in a level 1. I don't know whether or not there's a stipulation to say we're going to have 2 people. You have to have 2 people. When you have 10 people, you have to have, if you have 50 people, you have to have 3 first aids, etc. I don't know the correct details on those, but right now I would say you need a basic first aid kit with no specific training required.
Okay. And I touched on this before, but Heidi, it's kind of a 2-part question, so I'll read it out. And where can you find your industry hazard rating? Is this in the classification unit info? And if we are considered a moderate hazard rating based on our industry rating, which first aid training requirements would we fall into? So it's kind of a 3-part question. So number 1, where do you find your industry hazard rating? Is it part of the classification unit info?
Yes. So when you look up your classification unit, it will say manufacturing plastic parts. That's your classification unit, and it'll tell you that you are a moderate risk. Okay. So that is your hazard rating.
So if you're a moderate hazard rating, which first aid training requirements would we fall into?
So that's going to depend on the number of people you have at your workplace, your remoteness, your accessibility, etc. So it takes that into account. I haven't seen anything that's specific to say ABC, then DEF. I haven't seen that yet. So it's going to take a little bit of, let's see what that is. So maybe what I can do is I can have a look, and if I come up with the assessment and can walk through an assessment of how to complete it and the information you need, then we'll make sure that we get that out to everyone.
Okay, great. So one concern, and I'm sure several listening are concerned as well, the level 2 first aid was always the hardest to pass. I can't understand why such a drastic change. But again, that's not for us to
that's above
not
our
really
pay grade.
question, but yes.
Yeah. Yeah.
It's above our pay grade.
Yeah. So it could end up being that based on our industry hazard rating and our number of people at our workplace, that the level 2 is not going to be the go-to anymore. It might be a level 3, right? So it's just going to be a matter of looking at the standards, seeing where we fall into it, and doing our assessments. And somewhere somebody's made this decision at WorkSafe, and they've adjusted things to see fit. Again, they're trying to align with that CSA standard for first aid training.
Right.
So maybe the 5-day level 2 was never properly aligned with what it should actually have been. And we didn't need that. And we actually just changed it to the level 3 and the intermediate with the appropriate oxygen, etc.
Yeah, because that leads to that other question, the next question on here. It says, will level 3 be replacing OFA 2? Because how can a 2-day course replace 5 days of training? So yeah. So
again, the training is going to be the hardest one to sort of wrap our head around, to figure out where we fit in, and then to go and see what the training service providers have and how that reflects. So if we have current level 2, maybe that's enough and we meet the requirements of the new level 2, and you don't have to have recertification until the next time. And then we figure out what you need going forward.
Okay. Last question, because I know we're getting time. Can we just share again? Can you share again, Heidi, how they can access the CSA standard free, as you mentioned? If you can just confirm that again.
Sure. So if you go into the WorkSafe backgrounder document, There's a link in there for access to the CSA standard, and it takes you to the CSA website. You log in or you create a free account, and then you just type in CSA Z112220 or whatever it is, and it brings it up for free. And it allows you to have access to it. Because WorkSafe has cited it, they have to allow access for free.
I was going to add that because they've cited it, everyone has access to it.
Yes.
Thanks for that reminder. Well, Heidi, thank you again for sharing your insights and thoughts with us today. We're going to have to stop here. I have a couple of announcements for those that would like to stay on as well. We still have more questions coming in. So for the unanswered questions, we will sit down after this, continue to work through them, and we'll include that into the webinar resources. To everyone in the audience today, thank you so much for joining this discussion. And before we leave, like I said, there's a few announcements, and here's some news on what's coming up this month end and in 2024. So for those that have had the great opportunity to attend our Pinnacle Awards, nominations for the Safety Excellence Awards are now open. Presented at our Safety Pinnacle Awards Gala, these awards recognize the outstanding leadership of companies, teams, and individuals in health and safety. So learn more and nominate a leader, a champion, or your team at safetyalliancebc.ca Gala. Our first webinar in 2024 is January 23rd, and we will offer new perspectives on the new return to work legislation. Presenters from WorkSafe BC, KSW Lawyers, and TextMed Services will discuss Bill 41, the new return to work legislation, which goes into effect January 1st. On March 1st, join us in Victoria for Make It Safe Vancouver Island. It's our first time ever we are hosting an in-person Make It Safe conference on Vancouver Island. And if you're joining from the Okanagan, register early to join us April 18th in Kelowna for Make It Safe Okanagan. Both events are designed for your team with keynotes, expert sessions for leaders, HR, and safety professionals, as well as workshops for the safety committee members. New to this year, your live event ticket also gets you an all-access pass to Make It Safe online. Space is limited, so get your early bird tickets. Visit www.makeitsafe.ca for more information. And one last thing, did you attend the Make It Safe 2023 online in October? Did you know you have free access to all of the sessions? Catch up on sessions you missed, or rewatch one that you may find particularly inspiring. And if you missed it, you can watch it at Make It Safe on demand. Sign up for access at www.makeitsafe.ca/on-demand. Visit us online anytime for help or to access our full library of webinars, resources, and training. Watch for an email tomorrow with a link to the recording of today's session and a survey link to share your feedback and topic ideas. We're always wanting to ensure that we're relevant and that we are hosting webinars that are applicable and you all find value added. So at this point, just want to thank you again for attending, and we look forward to seeing you all in 2024. Until then, have a wonderful and safe